Hello everyone, it's Christina here at Ironhorse Physical Therapy and Pilates. Let's talk about shoulder pain and stiffness. When going about your day-to-day routine or your normal exercise routine, you might notice that one shoulder raises up when you're doing your lateral raises, or you feel some stiffness when you're doing your overhead presses, or maybe a little bit of pinching in the front of your shoulder when trying to reach into the top shelf of a cabinet, or even trying to do some rows. Well, why might this be happening? There are different reasons why you might feel all of these different sensations or symptoms in your shoulder with these activities, and it may not be limited to just your shoulder. There's so much overlap between your neck, your shoulder, and your mid-back that might be contributing to those symptoms. There are a lot of joints, nerves, and muscles that run through this area that may result in either pain, compensatory movement patterns, or feelings of stiffness. So things like the lack of mobility or the weakness of your shoulder musculature might be some reasons you may be experiencing discomfort or pain with movement. So let's take the example of weakness in your shoulder muscles. If you don't have enough strength in your shoulder muscles, like your rotator cuff or your shoulder stabilizers, meaning your rhomboids, which are the muscles between your shoulder blades, or your serratus anterior, which attaches to your ribs and your scapula to help it glide upward as you bring your arm overhead, that might result in your body using larger muscles like your upper trap to help get you through the movement. And that might be why you're seeing your shoulder hike up with certain exercises like rows or lateral raises or flies. Now, let's take the example of having a stiff mid-back. When bringing your arm up overhead, it requires a little bit of extension through your mid-back, and that allows the scapula and helps the scapula move and glide up overhead. If you don't have enough extension through your mid-back, that might result in the lack of mobility to get your arm overhead, or it might result in you overarching at your low back to help get your arm up overhead. And now the last example here is how your neck might be related to some shoulder discomfort. There are 7 different vertebrae in your neck, and the last 5 vertebral segments have an overlap in the shoulder. Sometimes stiffness in the neck joints, which are called our facets, might refer pain down into the shoulder. And the way we get stiffness in the neck could be many different reasons. But over time, when we're working at our computer for long periods of time or looking down at our phone for long periods of time, you begin to develop this forward head posture, which can cause some overstretch down in your upper trap, or even cause some stiffness in your neck joints, not allowing them to move and glide the way they need to because they are not in that optimal position. And so that might result in some pain or compensatory movement patterns when doing your exercises or daily activities. This is 3 of many other reasons why you might experience some pain and discomfort in your shoulder, but it's best to take a deeper dive and see how you move and what your strength looks like. So if you're curious about what may be causing your shoulder discomfort, come book an appointment with us so we can get down to the nitty-gritty and find the root cause of your pain.